I'm Lloyd Humphreys. I'm the Managing Director at COGNISS. And COGNISS is a no-code platform for helping people to create patient-facing digital health apps without any need for technical expertise, software developers, and therefore empowering the health system, industry, universities to create the next generation in a cost-effective and rapid prototyping way. So COGNISS is a no-code system that allows anyone to go into the platform to create their digital health product. So what you do is you log on to the interface, COGNISS Creator. It's a modular component, so you switch on modules, switch off ones, and you can combine various modules or widgets together to create your digital health app. And as you do so, you can upload your content, design your pathways, and design the actual look and feel of the app. And as soon as you get to the bottom of the screen and you click Save Changes, your app is created live immediately on demand. No need to wait for developers, no need to kind of wait for wireframes. It's a fully functioning app there and then ready to use. And so therefore it makes it much simpler to iterate, do user discovery, because you can actually change things on the fly. So if you've got a user discovery group, for example, and the group wants to change the button from blue to red, for example, in the previous, you'd need to kind of create a snag list, send it off to a developer, and that would take weeks, months, and a huge amount of cost. You can actually do that live in COGNISS, in situ, with that user discovery group. You can literally change the button from one color to another, click Save Changes, refresh the screen, and you can actually then show that to the user group. So that whole co-creation process is completely kind of turned on its head, let alone the kind of the speed of the development cycle itself. So the problem that COGNISS is trying to solve is the fact that it's incredibly difficult and incredibly expensive to build digital health apps. The average cost of building an app is around £334,000, 80% of which is on software development costs. And therefore that's outside the reach of most kind of academics, outside the reach of most universities, students, or even healthcare professionals, whether that's an organization or a clinical entrepreneur that's got a great idea to change the health system. Not only is it incredibly expensive, but it takes a long time. The average is 1 to 2 years to build a product, and only after 2 years, only about 80% of products are actually completed, and let alone all of the privacy, security, and regulatory hurdles in terms of handling sensitive patient data. And so COGNISS exists to break down as many of those barriers as possible. Because if you're a researcher, for example, within a university, having 1, 2, or 3 years to build a product and spending all of your time in terms of the technical weeds of being able to create that means that other areas become more difficult, such as user discovery, such as research, assessing the impact and the value of that kind of digital product. And so what we hope to do is to be able to shift the focus away from the technical into the things that really kind of add value in terms of that kind of digital health application. So we came to be working with the Time Centre for an introduction from Digital Health and Care Northern Ireland, and the Innovation and Ecosystem lead there, Sue Hun, really saw the importance and the power of being able to empower the system to create their own digital health products. And in doing so, there was a real desire and need to involve kind of research, university, and the health system alongside industry to have this tripartite relationship. And when you bring those three together, you are able to then be able to research, develop, and deploy digital health products in a really impactful way. Part of the process of being able to showcase the art of the possible in terms of digital health app creation was to have the Time Centre Innovation Award, which was sent out to the university to invite applications to build on COGNISS over a 4-week period. We had a number of applications and we shortlisted them based on feasibility, impact, value, and the ability to use no code in creating a full product within that time frame. So we spent 4 weeks supporting Devon, building a prototype of an app for people with neurodivergence called Big Feelings. Devon was a fantastic participant to have on the program, as she'd had no experience prior to using COGNISS of being able to develop or build an app, and no experience of using any code-based approaches. And so really showcased the art of the possible with COGNISS. Over that 4 weeks, she now has a product and a prototype that could be easily commercialized or go into a research study with just a little bit of extra work. What we hope to do with her is to extend the relationship, perhaps into a research trial, perhaps into kind of commercialization, and getting this into people's hands that could really benefit from this application.
My name's Paul Best, and I am Research Director for the Centre for Technological Innovation, Mental Health and Education, also known as TIME. So at the Time Centre, we're delighted to support the development of the Big Feelings app in collaboration with COGNISS and Dr. Devon Ramey. We feel this brings a lot of benefits to the work that we're able to do within the centre, and particularly thinking about our relationship with industry partners. We find that a lot of our staff, given their professional backgrounds, have good connections within the health services, but industry connections has always really been a missing link for us. So we really see this as an important next step where we can work together in a mutually beneficial way to create products and digital health solutions that we may not have had the funds to create ourselves. So partnerships such as those with COGNISS are something we're really actively supporting within the Time Centre, and just trying generally just to strengthen those collaborations and links with industry. So a lot of our staff obviously are subject matter experts, whether that be mental health, whether that be autism, whether that be child participation, family therapy, and so on. But what we're not is we're not software developers, okay? So that's a missing link for us. So we need to work with those who have that background, particularly those within industry, in which to really kind of deliver these sometimes complex health and social care solutions in a digital format. And that's where these collaborations really come into their own and are really important, and something within the Time Centre that we're keen to support and really value those relationships. So COGNISS is a really interesting industry partner in terms of what they offer. So I was really excited and intrigued really to hear about this idea of a no-code platform. So could you take someone, say like myself, who's got a professional qualification in social work and cognitive behavioural therapy, but isn't a software developer, and could someone like me take and build an app essentially from scratch? Something that wasn't just functional, but also looked good and could keep people's engagement. And that's where I thought COGNISS kind of stood out in what they were able to offer. I also think that rather than building transactional relationships with companies, to be able to have a long-standing partnership in which we could develop multiple products using the same solution was really attractive to us. It also meant that we could offer within the Time Centre access for staff working in sort of varying different areas, the ability to develop apps themselves and really retain some sort of sense of ownership and control over the process. What Dr. Ramey is able to do is take her subject knowledge regarding autism and neurodivergence and really translate that into a digital format via the COGNISS app. So one of the key challenges, I suppose, in this field is being able to recognise facial cues and emotions. And I think the Big Feelings app gives us a great opportunity in which to allow young people to experiment in a safe space, sort of recognising and responding to a variety of different emotions. And we're really excited to see the difference that make for families and the young people themselves.